Hi, I'm Miranda Wolpert. I'm Professor of Evidence-Based Practice at UCL and at the Anna Freud National Centre for Children and Families. And I've got 3 top tips here for those who are leading on mental health and wellbeing initiatives in their school, either as part of the senior leadership team or as the mental health lead within the school. I've already created a few top tips for people generally in the school that focus on encouraging people to look at the free resource of MindEd to train themselves in mental health issues, to look at the Youth Wellbeing Directory to understand what's available locally and in relation to particular problems, and to join the School in Mind network. And obviously I would encourage you to support staff to do those things. But the 3 specific top tips for school leadership team and for the mental health lead include, first of all, do start by auditing what you are doing as a school. There are a range of free structures and frameworks to allow you to audit what you're doing, including the Cascade framework, which allows you to look at how you relate to health service provision, and the IMARS framework, that's the Islington Mental Health and Resilience in Schools framework, that allows you to audit what you're doing in the school in terms of supporting individual children, working with parents in terms of curriculum development. And both of those are useful frames for you to use. The second thing I would suggest is, having audited, you may then want to measure impact year on year of any intervention that you're doing. So each school may choose a range of different things to do, and as part of the Schools in Mind network, we encourage schools to share ideas about different things that they want to do that are specifically helpful for their pupils and students. But we would suggest that you measure the impact of that in terms of children's own reported wellbeing and mental health. And we have a range of frameworks, the wellbeing measurement framework that we've developed for primary, secondary and colleges, that can be used on an annual basis to review progress and to see how people are feeling in your school and compare that with other schools. And finally, we would say a third top tip for anyone leading on mental health in schools is, don't forget the mental health and wellbeing of your staff. They're obviously the crucial component of any school, and you need to think about what interventions and means you're doing to support morale and wellbeing in the staff group.